Hello, welcome back again. This is Dr. DrYacobTekie. I'm a psychologist. In the second part of the video, as I mentioned earlier, we are going to talk about the treatment options. So if you have seen the first part of the video, we talked about the prevalence of seasonal affective disorder, the symptoms and cause, and who might be at risk of that, and how we can get diagnosed. And now I want us to take a little bit more time to talk about what options do we have. If you are someone who is diagnosed with seasonal affective disorder or struggling with the symptoms, what treatment options do we have? So generally we have three options, what we call light therapy, and psychotherapy and medication. But before we move on, I want to talk briefly, and something important, like if you are someone who is diagnosed with bipolar disorder, I'm going to say it again, if you are someone who is diagnosed with bipolar disorder, it's very critical that you tell your doctor that your diagnosis with bipolar disorder before they recommend you light therapy and medication. If you are diagnosed with bipolar disorder and your doctor didn't know about it and they recommend you light therapy and medication, it might put you in a manic episode. And trust me, you don't want to be there. It's very important to know if you have any symptoms of bipolar disorder and let know your doctor. So let's talk about these treatment options one by one. The first one, as I mentioned, is light therapy. Light therapy is what we call phototherapy, and it is this kind of instrument that you can find it on Amazon or any kind of retail stores, and the price is reasonable. You can find it from $25 to $100 something, depending on the type and size. So this light therapy, you kind of put it a feet or two away from your face, like this one, like where it mimics a sunlight, a real sunlight. As I mentioned earlier, generally we struggle with seasonal affective disorder as a result of the change in biological clock and serotonin and melatonin, and this light therapy actually helps you to create a sunlight, artificial sunlight, to help you gain some it mimics the natural sunlight. This light therapy might take few weeks to kick in, so it's not something that's going to work right away. If you use it a day or two, you might not see some change. That's why it's very important to talk to your doctor and know for how long do you need to use it, how long I meant like how many hours, and for how long, in terms of days, and what type of light therapy that you're going to need. So it's important to spend quite some time to talk to your doctor and shop around and use it, and in few days or few weeks you would see some change. The second treatment option is what we call psychotherapy, or generally called talk therapy. I hear a lot of people or my friends call I don't want to go to a shrink, and shrink is the therapist that I'm talking about. So your psychologist or psychiatrist or clinical social worker, they might do a treatment what we call cognitive behavior therapy. And this treatment option might help you to develop some coping skills. It might help you to understand what the causes are, like how we can improve your behavior, or learn some coping skills or stress management techniques that would help you improve your thought process, your mood, and your behaviors. So it's very important to spend quite some time with your psychotherapist to talk about these changes. And as a result, you might be able to learn ways that you can manage your stress. It's not necessarily that your problem is going to go away, but at least you would know how to manage it, how to deal with it. Especially, like if you felt like you have, for example, an upcoming project or final exam, that you have to finish, and if seasonal affective disorder is kind of, becoming a problem to finish your projects, your psychologist might help you to devise some ways how you can, help yourself so that you can finish your work. And in the long run, also, you might learn some ways to process your problems and your issues, and as a result, solve the actual mood problem that we have, or the seasonal affective disorder. So it's important to take time to talk to your psychotherapist before it gets severe. If it is severe, then you might need to move on to what we call probably require some medication. So the last option that we have is maybe if it is a severe symptom, then you might need medication like Wellbutrin, some kind of antidepressants. But as I mentioned earlier, I want to say that again and again, before your doctor, prescribes you any medication, any kind of antidepressant, make sure that you tell your doctor if you are diagnosed with bipolar disorder or not. If you are diagnosed with bipolar disorder and you get antidepressants, that's going to put you in a manic episode. So that's not really a good thing. So these are the three major options that we have. They all have their own advantages and disadvantages, but the best option for us is to talk with our physician or psychologist or psychiatrist and know what the best treatment that we can have. All of them could work depending on the type of problem, the severity, and for how long you had it, but it is important to understand your symptoms first before you jump in and do anything on your own. I don't recommend you to take medication on your own or do any other kind of, light therapy without consulting with a professional first. So it's very important to take time and talk to your doctor. Other options that we have are different things that we can improve our coping skills. One of the important things, what we call the mind-body connections. Maybe if you are familiar with some kind of relaxation techniques or deep breathing, yoga or meditation, these things really help a lot. Of course, I know that you can find a lot of YouTube videos that could teach you meditation, yoga, and some kind of mindfulness or deep breathing exercises. But it's very important to incorporate it in your lifestyle. We know that these things really help you to calm down, especially to manage your stress, and to be very mindful of what's going on, like how you can really elevate your mood or without feeling, without really feeling bad about the symptoms of depression that you are struggling with. If we can create a healthy relationship with our negative feelings, it actually becomes a lot better. And there's a lot of research that shows that if we can create a healthy relationship with stress, depression, and other things, the symptoms significantly decrease. But also there is tons of research that shows that meditation, mindfulness, and yoga really helps to improve our well-being. Other options that we have are like art therapy. Art therapy is in a way very relaxing and very engaging. I'm not an artist, even though I mess with my hands every now and then. But if you could find someone who could help you, with some kind of art or sign up for some kind of activity, it actually helps a lot of people, to help them feel calm and relaxed. Apart from this, there are other things that we can do, like that might help our mood a little bit better. If your room is very dark and it doesn't allow a lot of sunlight, try to open the curtain. Allow more light to get into your room. Or try to sit in, by the window, or try to go outside, take a walk, and make some changes, in your lifestyle. Of course, if you are someone who hates, the winter season, you might not be encouraged to leave your apartment or your room, and take a walk. But actually, it's very encouraged and it's very important. Even if it's full of snow, just go out, take a walk, take a hike. And if you are someone who has been very active, also exercise is one of the most important things that we find very helpful. I just want to say a little bit more about that. A lot of times people say, like, you have to exercise, you need to strengthen your muscle, your well-being. But a lot of research shows that exercise is one of the most effective treatment for anxiety and depression. So even if it's cold outside, try to bundle up and try to go outside and jog or take a walk as much as you can. So these things really help a lot. But other things that I would encourage you as a psychologist is, if your therapist or family doctor or psychiatrist or anyone recommend you any kind of treatments, it's very important to stick to the treatment plan. You can't take your medication one day and not take it the other day. You have to take it consistently based on the recommendations. Sometimes you might need to take your medication way after the season is over. So if your doctor recommends you that, I highly recommend you also to follow the recommendations that you have. A lot of people, in my experience, especially in the Habesha community that I came across to, once they start taking the medication and feel better, they just drop it. And this is really a big mistake in terms of treatment. So stick to it, finish the treatment. Sometimes you might need to take it for months. Sometimes you might need to take it, for weeks or years. It doesn't matter, it's treatment. It's like diabetics or heart attack or any kind of physical problems that we have. So you need to take your medication as regularly as it is recommended. Other things, it's important to take care of your health too, in terms of getting enough sleep. Instead of staying late, to watch movie or, going out, get your sleeps as much as you can. Don't disturb your sleep. Disturbed sleep is one of the most important and problematic issues for any kind of mood problems that we have. Whether you spend a lot of time in bed or you don't, they both equally impact your well-being. So try to get as much sleep as you can. Try to eat as healthy as you can. Next time I will talk about sleep and the type of food that would help us feel a lot better. But try to Google and find some kind of information. What type of food really makes you feel good? How we can improve your diet and health. Other things, practice some kind of stress management techniques. Whether it's mindfulness, actually mindfulness is one of my favorite things that I teach and that I practice, and I will talk about it also next time. But try to find some kind of stress management techniques that works for you. It could be taking a walk or playing video games or playing chess or any kind of meeting friends or going to the museum, reading a book, whatever it is that helps you feel calm and better. Try to put it into habit, and that might help you a lot better. Other things that we find very helpful in terms of seasonal affective disorder is socialize as much as you can. Even if you don't feel like meeting people, force yourself to get out of your room, go to the living room, meet your parents, your friends, your roommates, anybody that you can socialize with. Slowly, this kind of things, become a chain reaction that makes you feel a little bit better. But if you say, like, I don't want to meet people, I don't feel like meeting people, and you kind of close yourself in your room, that's going to make you more feel depressed. So force yourself. It's going to be a lot better, trust me. And last one, if you seriously struggle with seasonal affective disorder, and for example, you are living in Canada or, like the Scandinavian countries or anything, if you can afford it, take a trip to tropical areas. Travel to, sunny places, where you can, take a few days off and relax a little bit. And this helps a lot of people, especially, as I was saying, if you can afford it. So these are the major things, that I think are important and helpful in terms of dealing with seasonal affective disorder. I know that there is a lot to talk about, especially these non-traditional treatments like mindfulness, yoga, and other things, and I'll talk about them one by one next time. But Google, watch some YouTube videos, and if you felt like these symptoms are something that you are struggling with, I highly recommend you to reach out to your doctor and get the treatment as soon as possible. As I mentioned earlier, if you can diagnose it early, it is very preventable and treatable. So you have nothing to worry about. So thank you so much for watching today. If you have any comments, any feedback, please leave below. And you can see also on the last part, like you can follow us on Instagram, Facebook, and YouTube, and I will post more videos in the coming few weeks. If you have any question, as I said, leave a comment. If you have any topic, anything that you feel like you need to know about, I will work hard and I will make it ready, both in English and Tigrinya. Unfortunately, those two things are the only thing that I can talk about. So leave a comment, leave a topic, leave your experience, what you think about it. If you struggle with seasonal affective disorder, you can message me privately if you don't feel like you want to share it publicly, but I would truly appreciate any kind of feedback or comment that I would get. Thank you so much. This is Dr. Yacob Tekie.